Hi class, I'm just going to present my patient. So I have a 56-year-old Caucasian female who presents to the clinic alone today. She appears to be a reliable historian. She states, I've been feeling especially fatigued and I feel like I've been gaining weight. She expresses that she's been feeling healthy, but over the last 6 months to a year, she's been feeling especially tired and gaining weight despite her regular exercising. She drinks 1 to 2 cups of coffee a day. She has a healthy lifestyle. She ran a long distance race last week, feels like she is in great shape. Nothing seems to be making her fatigue better or worse. She just mostly feels fatigued throughout the whole day. She feels more exhausted than sleepy. And then she reports that she's gained 15 pounds in the last 6 months, but denies having changed her diet at all. Her past medical history includes hypertension that was diagnosed in October of 2019. She has never been hospitalized or had surgery. She's taking valsartan 160 milligram tablet daily for her hypertension. No use of alcohol, drugs, or tobacco. She just drinks 1 to 2 cups of coffee a day. She's up to date on her vaccinations. She's up to date on a colonoscopy and mammograms. She's postmenopausal, no longer having periods. She denies any allergies to food, drugs, seasonal, or environment. She states that she drinks 4 24-ounce water bottles daily, exercises for at least 30 minutes a day, and eats a healthy, balanced diet of fruits, vegetables, grains, and meats. 24-hour recall of food includes eggs, chicken salad, apple, and chicken lettuce wraps. As far as sleep and stress goes, the patient expressed that she does not have an overly stressful life, and she sleeps 7 to 9 hours a day, or a night. The patient's mother has a history of hypothyroidism. The patient's paternal grandfather has had type 2 diabetes mellitus, no family history of anemia or sleep apnea. Pretty much the patient just stays home. She doesn't have any occupation per se. She works around the house most days. She's married and has 3 kids that are all out of the house. She is sexually active, feels spiritually fulfilled. She feels like she's safe, denies domestic violence or abuse. As far as review of systems goes, constitutional, the patient reports unusual weight gain of 15 pounds over the last 6 months. She also reports fatigue over the last 6 to 12 months, and the patient denies fevers. Cardiovascular, the patient denies peripheral edema, dizziness, or chest pain, but reports fatigue. Respiratory includes dyspnea, cough, and wheezing. She denies all of those things. As far as GI goes, she denies upset stomach or abdominal cramping. She has soft daily bowel movements with no discoloration. She denies nausea, vomiting, constipation, and diarrhea. Integumentary, the patient has been having dry skin, cracked nails, and excessive hair loss. She denies any rashes, cuts, lesions, or hives. Psychiatric, she denies any signs of depression or anxiety. Endocrine, she denies excessive sweating, denies heat intolerance, but she feels like she's always had a little intolerance to the cold. She denies polyphagia, polydipsia, or polyuria. Her vital signs are stable, nothing out of the norm. Her BMI is 20.52. She's 6'1", 135 pounds. General appearance, on my physical exam, she appears well, seeing the no signs and symptoms of distress, malnutrition. She's alert and oriented, memory's intact. She responds well to the exam. Her skin is consistent for ethnicity, but it does have a dry texture. There's no eruptions, lesions, or edema, scarring, dilated vessels, hemangiomas, or bruising. The skin has good skin turgor and elasticity. No tenting noted, no striae. So skin's good, just dry. Her hair distribution and texture is appropriate for age. No major thinning of hair noted. Temporal pulses are easily palpated. Her neck is supple, no swelling or lumps, no trachea is midline. There's no thyroid swelling or enlargement noted. She's got full range of motion. So respiratory system is good. No, there's no masses. Resonance is good. No adventitious breath sounds. Heart sounds are all good. No normal S1, S2. There's no heart murmur, no bruise noted. Her abdomen is flat, no peristalsis or pulsations noted. She does no masses. Her liver size is good. Her spleen is unable to palpate. The extremities are good. No deformities, edema, or coldness noted. No redness, limitations, tiredness, or stiffness in the joints. No clubbing of fingers. Distal pulse are 2+. So there's the exam, and there's the patient presentation. As far as differential diagnoses go, hypothyroidism is probably the leading diagnosis, as evidenced by abnormal weight gain, dry skin, excessive hair loss, and fatigue. Anemia could also be possible. Depression could also be a possible cause of weight gain and fatigue, though she denies it, so it's less likely. Diabetes is a possibility, especially with family history of diabetes, and then with the weight gain and fatigue. So the leading diagnosis is hypothyroidism. The plan would be to check some labs. So CBC will rule out anemia and infection. A CMP can look for electrolyte imbalances and kidney and renal dysfunction, which can also lead to fatigue. TSH was reflex free T4 to check for disorders of the thyroid. Hemoglobin A1C to rule out diabetes. We could also do a spot check of blood sugar while she's tired. Therapeutic plan, there's no meds at this time. We'll wait for results. Patient education, educate that there are quite a few possible causes of her symptoms, the most likely being hypothyroidism based off of her symptoms. Checking this variety of ordered labs will rule out hypothyroidism as well as other causes. Also talk to the patient about depression. It can be a cause of her symptoms, just to look out for those signs. And then follow up in 1 to 2 weeks to go over the labs. Follow up if sooner in the office if she's having dizzy or fainting spells or symptoms seem to be getting worse. And there's my patient.